Hi guys, welcome back to my channel and welcome back to another episode of Health Talk. And on today's episode we'll be discussing on female infertility as àrùn àìrọ́mọbí lára obìnrin. And please don't forget to like and comment at the end of the discussion. What is female infertility? Female infertility is an inability to get pregnant and have a successful pregnancy. Kí obìnrin má lè lóyún tàbí kó má lè lóyún àìníyege, ìkan tá a mọ̀ sí àrùn àìrọ́mọbí lára obìnrin nìyẹn. And it's a common disease out there. Female fertility is very common out there because 10% of women has to deal with infertility of some kinds. The chances of being infertile increases as the woman ages. The older a woman gets, the more the chances of being infertile increases. So what are the causes of female infertility now? 1. Problems with the uterus, àrùn ilé ọmọ, and this may include polyps. Polyps is a mass of tissue that bulges or projects outward or upward from the normal surface level of the uterus, or fibroid or septums, or even adhesions inside the cavity of the uterus. All this can lead to infertility. Polyps and fibroids can form on their own at any time. Anytime they form on their own, while other abnormalities like symptoms can be present at birth. During birth, a woman may have symptoms from birth, while adhesions inside the cavity can form after surgery like D and C, your dilation and curettage. Yes, adhesion can form after surgery like dilation and curettage. There might be adhesions, and this can cause female infertility. Another causes of female infertility is problems with the fallopian tube. Yes, problems with the fallopian tube. And the most common causes of tuber fatal infertility is pelvic inflammatory disease, which are caused by either chlamydia or gonorrhea or any untreated STIs. Any STI left untreated can lead to tuber factor infertility, which can lead to it's a major cause of infertility out there among women. So a whole lot of women out there lived any STIs or any infections they left untreated, which later affect the fallopian tube and later leads to tuber factor infertility. That's why it is very advisable to be as early as possible treat your STIs. Any infection you have as a woman, try to be treating it every day. Tóbìnrin bá ní any infections tó bá ní, ká try láti máa treat it. You treat it early as possible. You don't leave your STIs untreated, but it can later result in tuber factor infertility. So another problems of infertility in female is egg numbers and quality. Yes, egg numbers and qualities. A woman is God created women with the whole number of eggs they will ever have, but this surprisingly can run out before menopause. This number of eggs they can run out before menopause. And also some eggs may have wrong numbers of chromosomes, which cannot fertilize or grow into a healthy fetus. So when an egg have a wrong number of chromosomes, the egg cannot fertilize or grow into a healthy fetus, and this can also result in infertility in women. So another problems of female infertility is problems with ovulations. Yes, problems with ovulation, and there are some causes that may make a woman not to ovulate regularly. Once a woman doesn't ovulate regularly, there is no release of egg from the ovary, and once that doesn't happen, once an egg is not released from the ovary, there's nothing to fertilize. Even after having protected sex, there's nothing for sperm to fertilize. The sperm won't have anything to fertilize, which is a major cause of infertility. And one of the causes which can make a woman not ovulate regularly are hormonal imbalances. Yes, or severe stress. If a woman overstress herself, once you overstress herself, undergo severe stress, you might not ovulate regularly. Or substance abuse. If a woman is abusing substances like hard drugs or even some narcotic analgesics or some sleeping pills, if you are abusing them, please stop, because they can cause infertility. They can lead to delay in your ovulation. They can cause problems with ovulations, and therefore they can cause infertility in female. So substance abuse, severe stress, hormonal imbalances, or any past eating disorders, or even some pituitary tumors and thyroid conditions. They can cause a woman not to ovulate regularly, and once the woman doesn't ovulate regularly, it can lead to infertility. It's a major cause of infertility. And so some risk factors of infertility. Now, what are the risk factors of infertility? One, age. The older a woman gets, the more the chances of being infertile increases. That's why it is very advisable to give birth early. Try and, because the more a woman ages, the older you get, the more the chances of being infertile increases. It deals with age, and also with obesity. If a woman is obese, then it's a risk factor for being infertile. And once you are even underweight, if a woman is also underweight, it's a risk factor for being infertile. So and also hormonal problems with ovulations, and also some autoimmune disorders like lupus and arthritis, endometriosis. They are risk factors for infertility. Female infertility cannot be predicted or prevented, but some risk factors that can cause female infertility can be controlled, like our lifestyle, the way we are living, what we do on daily basis. We can control them to reduce the risk of being infertile as a woman. Like, if a woman is smoking, like a woman that is smoking, you can quit smoking. You can quit alcohol consumptions. Yes, all this is not even for being infertile, but also to have a healthy life. Yes, and also having a very good exercise habit. You don't have to underweight yourself. Like, you don't have to overstress yourself in the process of exercising. Don't overstress yourself, and try your weight should be balanced. You don't have to be obese, you don't have to be underweight for you to be for the chances of being fertile to be more increased. You have to develop a very good lifestyle, develop a very good eating habit, and develop a very good exercise habit. So we should maintain a healthy lifestyle. So please, on our next discussion, we'll discuss more on female infertility. But for now, as a woman, please try and remain fertile. As a woman, it's a woman's right, it's a pride. So please don't forget to like and comment. And for those who are joining us newly,